Hi, my name is Lami again. I'm TraXel's nurse coach. I'm board certified health coach and a registered nurse. I'm here with another episode of Holistic Approach to Wellness with MS. I was diagnosed with MS in 2020. And holistic health through nurse coaching has helped me just with not only my personal health journey, but also with my life journey as well. So it's been very helpful. I'm super excited today to have a special guest with me. I have Dr. Lisa Doggett here with me, and we'll talk about what she does. Hi, Lisa.
Hello.
She is a family medicine doctor. And we'll talk about what lifestyle medicine is and just tips on healthy habits and good, just good self-care tips, things like that. And kind of just talk about our stories also in general. And I'll do a formal introduction here in just a second. So I wanted to say first, I heard about you when I was first diagnosed myself. And I was just doing research and your name popped up. I believe it was probably with your blog and website, which is interesting because you also have MS as well. Right. So I've really found a connection with that, of course. And I feel like both of us as healthcare professionals have this unique perspective of being on both sides.
Being on both sides,
yes,
yeah.
Kind of knowing what we know, but then also being a patient, I feel like is pretty relatable, and then we do have that much more of a different aspect to view and really help
kind of a different angle,
for sure, different angle, yes. And so officially Dr. Lisa Doggett here. She is a family and lifestyle medicine physician and author of an award-winning memoir called Up the Down Escalator: Medicine, Motherhood, and MS. And actually that's where I first met you, was at one of your book signings.
Great.
Yeah, so that's 2-3 years ago already.
2023.
Yes. So that was great. I loved it. And you had great places that you were doing it at.
Yeah. That was awesome.
And then so also, you have so many roles. I could probably only go off the tip of the iceberg with everything you've accomplished and what you do. But I also like to mention too that you and your family have such a strong connection and commitment with public health and service, which I love because I often talk about the importance of community, how it's so helpful with just feeling belonging, with support and feeling belonged and in a community, and how it can help in so many ways. But again, I can't go over exactly everything you've done because there's a lot. But we will talk about your website, which everybody can always look at also. And then so first Again, I found you through your blog and your newsletter, which I find is super helpful, has a lot of great information. So thank you for that, because that's kind of how I even got, like I said, involved with what you do. Or interested, I should say, in what you do. But okay, so first to start off, when were you diagnosed and what were your symptoms, and can you tell me about them?
Yeah, I was diagnosed in 2009, so it's been about 15 and a half years now. Initially, I had dizziness, and it was this weird, vague feeling that I can't even describe now. I've really struggled with kind of like motion sickness, maybe not enough sleep or jet lag, but this weird feeling, and I couldn't explain it very well. And I sought care from a neurologist. She didn't really think much of it, but then I started getting new symptoms, and I had some taste changes and double vision, and ended up getting an MRI and landed with the diagnosis of MS.
Okay, wow. So taste changes also.
And pretty strange.
Issues. Okay. Was that over, what period roughly would you say?
Quickly. It was over the course of a week. I was diagnosed in 8 days.
What? Really?
Yeah.
Wow.
Yeah. I was very fortunate.
Yes.
I know. I was lucky. I had a lot of connections with a physician, and I reached out to friends and colleagues that I knew personally and was able to get care very fast.
Good. And do you feel like, of course, being a physician probably helped, not just your connection, but just obviously kind of knowing what you're doing?
It is unfortunate that other people don't have that kind of access, because it made all the difference for me, and I was very aware of it. At the same time that I was diagnosed, I was running a clinic for people who didn't have private insurance.
Yes, that's right.
And I saw them having to wait months, sometimes years, to get in to see a specialist. And I was able to call an ear, nose, and throat specialist on his cell phone on a Sunday afternoon and get in the next day to see him.
Wow.
I mean, it was incredible access. And then I think in addition to that access, doctors really took me seriously as a colleague.
Right.
So, you have a 30-something-year-old woman come into your office who's having this vague dizziness and maybe some visual changes, and you're really rushed. And as a physician, from that perspective, that you may not really think much of it. And then with MS, 85% or so of cases are relapsing remitting, meaning you have those periods of remission. So it's quite possible that I could have, in other circumstances, waited a long time to get care. My symptoms would have remitted.
Yes.
I would have maybe not ever got care because I was doing better, and then had another, potentially worsening of my MS without treatment.
Yes, you're so right about that, and you're so on point about how people are often not heard, but you, as a doctor, they took you seriously.
They took me seriously.
That's something that I try to be mindful of again with patients. Is like, listen to them. They know. Right.
And as a patient, you may have to be persistent in seeking answers to questions.
100%. I love that you mentioned that, because I like to also just make sure, like I tell everybody, you have to be an advocate for yourself.
For sure.
And if one doctor or whatever health system doesn't, listen to you, there's others. When one door doesn't open for you, keep going with others.
Right.
Get support or ask questions. Always ask questions, right?
Right. And do it in a respectful way. If you go in and you're shrill or you're tearful or you seem super, anxious or like that will be a turn off for the doctor too. So go in, act calm and professional, collected, have someone with you who's also going to present your story in a calm way, and you will be more likely to be taken seriously. I wish that it were the case that everyone was given equal treatment. Unfortunately, that is not reality.
Right. That's a good point. And I was also just going to add, even like 10 minutes before your appointment or anything, like just kind of take some slow deep breaths, be compressed to do that, because it's hard, right? Like you have a lot of emotions and a lot of either anger or whatever. So take 5-10 minutes before, write down what you need to talk about. Things like that are helpful.
Right.
Yeah. So that's great. And I guess that's, for me, I kind of fell into what you were just talking about. Like, I had random issues with limping with my leg, and it was very minor compared to now. But there was just something was just weird with my leg, but it was happening randomly with a walk. And then it didn't happen again for a year later.
Wow.
Yeah. So of course, if it's not happening frequently, I was just like, kind of brushed it off.
Yeah,
and then
it's gonna go away.
Yeah. So anyway, so I think that was part of my delay with treatment, was just because it's like, okay, can't go to the neurologist when nothing's going on per se, or if that happened a year ago. So I know a lot of people struggle with the weirdness of our symptoms.
So many strange symptoms.
Non-textbook.
And it can be hard now, even for me, to tell the difference. Sometimes when is this MS, this is something else. And it's not always clear cut at all.
It is, which makes it even more difficult for sure. Okay, and so would you say that MS helped lead you to lifestyle medicine, or can you talk about what?
Sure, So I practiced in community clinics for 13 years, doing family medicine, traditional family medicine, caring primarily for people who were low income, who lacked private insurance, as I said. I then took a break and did some other kind of bigger picture health management work, where I was not doing regular patient care. And finally, I came to lifestyle medicine back in 2023, same year that my book was published, actually. And I had all along really felt strongly about healthy habits, really promoted that in my patients, and really tried to incorporate that into my own life, just recognizing how important self-care was with MS. But then I learned about this whole field of medicine, lifestyle medicine, where I was able to get formal training and then become board certified later that year.
Love it.
Yeah. So lifestyle medicine is a newer field of medicine. It is its own specialty, and it really focuses on 6 tenets of health. And I think we're going to get into that later.
Yes.
But yeah, it's about preventing and potentially treating chronic, and potentially even reversing, in some cases, chronic conditions.
Oh, wow.
Through healthy habits and making healthy lifestyle choices.
I love that, because a lot of people don't realize that things can be reversed. Not everything, but some things can be reversed, and I find that fascinating.
Yeah, it's really incredible.
Yeah, you really do the research and do the work and look into it for sure. And then I was going to say real quick how the same thing, we align in a lot of ways, but nurse coaching is somewhat similar to lifestyle medicine, because we talk about holistic health, or like just looking at the bigger picture.
Sure.
And the root cause kind of thing, and like everything that you can do in addition to medications and procedures and things like that. Like what we have in our control. Also help. So I love that. That's very similar to what nurse coaching is.
Sure. And I'm sure you're setting goals and all of that as well. So it's a good way to do it. So now in lifestyle medicine, I work at the Dell Medical School here in Austin, and I provide coaching and support to other people with MS, which has been just an incredible opportunity. So I love working with other people with MS. I share that I have the same diagnosis, and I think there's a real connection there that has been really important for me, being able to help others change things.
That's huge, because of course you understand truly what it's like, not just symptoms, but just the whole process of getting diagnosed and treatment and everything that goes with that, like dealing with family and everything. So
communicating,
truly,
the uncertainty, all of that for sure.
Yes. Okay. And then so what are there's 6 tenets of lifestyle medicine?
Yes, so there are 6 tenets of lifestyle medicine. So those include a healthy diet, and in particular, a whole food plant-predominant diet is recommended by the American College of Lifestyle Medicine. The second tenet is physical activity, and the American College of Lifestyle Medicine is consistent with national exercise guidelines, which say 150 minutes of aerobic activity per week, plus 2 sessions of strength training of all major muscle groups. So that's tenet number 2. Third one, or they're not really in any particular order, but a third tenet would be sleep, sufficient and restorative sleep. It's recommended to get 7 to 9 hours of sleep per night. Fourth is stress reduction or stress management. I think that is kind of obvious, and is a tricky one, certainly the hardest one for me, but very important with MS. Stress is an inflammatory or contributes to inflammation, increases our risk of all kinds of other chronic conditions, and potentially can make MS worse or MS symptoms worse. So fourth is avoidance of unhealthy substances, particularly in MS. This is relevant because smoking is a huge trigger for MS relapses and progression. But also we want to make sure you're not overdoing it with alcohol. Marijuana can be useful for some MS symptoms, but also people misuse it, and it has health consequences as well. And then the final tenet is my favorite, and that is connection with others. And what you're doing with this podcast is a form of connection. But just that human to human interaction, connection. It can be connection with animals or with nature too, but connection is absolutely essential for good health.
Yes, everything you're saying is things I've talked about in the past, and what my TraXel.com is about. It's just wellness in so many aspects. So love that you just said all that. But especially the unhealthy habits, or like you said, like
avoidance of unhealthy
substances, things like that. And of course, again, everything's about moderation. Right? Not to say that you can't do any of those things per se, but just moderation and kind of watching that. So I love that. And then do you happen to have any advice for like help with nervous system regulation or anything like that? Or?
Sure. Yeah. I mean, I think all of these tenets of health help improve your brain health and help you regulate your nervous system. But I would say in particular, one of the most important tools that I've developed in managing my MS symptoms has been mindfulness, and particularly mindfulness meditation. I was skeptical about this. I actually have a chapter about it in my book because I was so skeptical, and I thought, well, I had a couple of physician friends who were encouraging me to try mindfulness-based stress reduction as a technique and to take a class. And I ended up taking, there's like a standard 8-week MBSR class.
Okay.
And I ended up taking one in 2015. And several years after I had been diagnosed with MS, and still was having dizziness pretty often. And I took MBSR, the class, because I really thought it would help me with stress. And it ended up helping with my dizziness. And I tried so many things, and I was flabbergasted and thrilled because really nothing else had worked that well. But I now have learned how to meditate, and I do that every morning and every evening, at least a short session. When I have really dizzy days, I'll sometimes do a little bit extra. Meditation, particularly mindfulness meditation, has been shown to be helpful in reducing chronic pain as well as anxiety, and helping with stress, sleep, depression, potentially other symptoms too.
Yeah. I love how it all just comes together.
Right. Yeah.
It all affects the other.
Yeah. So, I mean, that is definitely a really, really great tool for helping just kind of regulate your nervous system. And again, I have less dizziness, but when I do have dizziness, I know how to just accept it and live with it. And it's about just sort of noticing what's going on in the present without judgment. And it's really been an important shift in my mindset.
Yes,
I'm learning how to do this.
I love that. Mindset is huge to me, especially with dealing with this disease.
Yes, indeed.
Yeah. But what was it again? You said it was MS or
MBSR, so mindfulness-based stress reduction.
Oh, okay.
It's a form of meditation, and there's an 8-week class that you can take to learn more about it. There's also all kinds of great apps out there, like Insight Timer. There's one called Headspace and Calm. I have a handout that I've shared with patients. I can share that with you, actually.
Okay, yeah.
And it has a lot of resources on there.
Great. I don't know if I heard of that one specifically, so that's always good to know. I love learning everything. Yeah. But again, we align on this as well. I never really had like a morning routine, and I certainly never just meditated. Like, never was against it per se, but I was just like, I don't know, that's something to do. And anyway, kind of got more into yoga, and I was like, it made sense with that of just being more still, mindfulness.
Yes, there's a lot of crossover with yoga.
Yes, but I have been doing it now, like you were saying, every morning. I do my yoga and meditation as a morning routine. Again, you have to understand, I have never, my friends laugh at me when I talk about it, I've never been a routine kind of person. I'm a very go with the flow, like free-spirited, like batch, right? And for me to have a morning routine is just, it's crazy. But I do have to say it has been extremely essential for my health and wellness.
Yeah. No, I think that's really
especially
great.
Practicing it every day. I've talked about that before. Like, don't just wait for flare-ups and things like that. Like, incorporate it into your daily life, and then you will definitely notice a difference. And it's not going to happen overnight. It does take baby steps, but just do a daily routine, and you'll notice.
Absolutely. Yeah.
I love that. And then, so one thing too, I also wanted to talk about was you mentioned like cognitive shuffling for sleep.
Oh, yes.
Because I do need something to help.
This is a great technique that I just learned about pretty recently, and I've now started using it myself as well as sharing it with patients. So cognitive shuffling is a technique with sleep where if you're struggling to fall asleep, or you wake up in the middle of the night and then can't go back to sleep, it's important to, and you're distracted by anxious thoughts. So I guess that's the other kind of caveat. So you're trying to fall asleep, and you're worrying, and you're just like perseverating. And oh my gosh, I will do this. Like, middle of the night, something that's not that big a deal during the day is like just amplified. It's such a big deal. And so cognitive shuffling is this technique where you can kind of reset your mind. And what you do is you think of a word, and I'll think of one like rest or restore, or I mean, it can be anything, peace. I mean, it can be, animal. I mean, whatever, any kind of word. And then you go through each letter of that word and think of as many words that start with that letter as you can. So if you do rest, you're going to go R. Okay, rest, relax, restore, rhinoceros. Like, just think of every word that you can with R, and then once you kind of run out of words, go to the next letter.
Okay.
And so you'll do E and start thinking of those words. And you can just go through multiple words, but I usually don't even get through an entire word.
Really?
It's incredible how much it will help you shift. Sometimes I have trouble staying focused on it, but it's been really a good tool to have.
I am 100% gonna have to try that, because I do that where my brain just keeps going.
Yeah. So yeah, look up cognitive shuffling if you want more information about it. Yeah.
I love that. And it's just, the point of it is really just so you can just focus and not think about all the other things.
It helps shift your mind away from whatever that repetitive thought is that you're anxious about.
Okay. And it's super easy to do. You don't even have to get an app for that.
Right. Yeah. It's great. Just start to do it.
I love that. I love my apps, but it's like I just don't need it.
Yeah. No, this one is great. You don't need any tools or anything.
And also, I want to just talk about what are some personal, like, daily habits or weekly habits that you incorporate just to help manage symptoms, or just in general for health?
Yeah. So daily habit, I think first one for me, besides a mindfulness meditation, is exercise. I exercise every day first thing in the morning. That is just part of kind of my routine. I have really made that a priority. Even when I travel, even when, it's raining outside, I have some way to accommodate my need to exercise, and getting moving is so important. In fact, it's probably, of all the different areas within lifestyle medicine, it's probably the most important in terms of preventing MS progression specifically.
Interesting. Yeah.
So that's a big one. Secondly, I really do try to make an effort to get enough sleep. I think that's essential. I try to go to bed and get up at the same time. I try not to get on my phone in bed. Really trying to just make sure that I have a good sleep environment, cold, dark, without noise. I have a noise machine. I have earplugs. Like, I really kind of just make sure that I've made it a priority, and also to make sure I get enough sleep, I avoid caffeine. Caffeine is fine for most people and fine for MS. Can be actually very helpful for fatigue. For me, it's a trigger for my dizziness.
Oh, it
took me a while to figure that out.
Really?
Yeah. So I have to wait for dizziness, but it is a major issue for sleep for me. For most people, it stays in your system about 6, maybe 8 hours. For me, I know I'm very sensitive to it, and I can't have any caffeine, particularly in the afternoon or evening. But a lot of my patients have that sensitivity too. So if you're struggling to sleep, fine, have your morning coffee, but then after 1, 2, 3 o'clock, you want to stop all caffeine.
Okay.
So that's another one. And then I think just in general, on a weekly basis, I make sure that I have an opportunity to connect with my family. I go on a bike ride almost every weekend with my parents. I have a friend that I go running with every weekend. I really do try to prioritize those connections. And just overall to kind of have that mindset of like, my health matters, and I am going to make accommodations to be sure that I'm able to do those things that I know will help me feel regulated and calm and feel my best.
Yes. I love that because especially when you're talking about just prioritizing exercise no matter what, traveling, like that doesn't deter you.
Still do it.
Just find a way to do it. I think that was my problem before. I'm working on it and getting better, but yes, I kind of would like do things, work, get done, things with work, and then dealing with my kids and like doing everything else. And then it's like, okay, exercise later.
Right.
Instead of what you're doing. It's just prioritizing that 100%. It's like brushing your teeth, kind of.
Right.
You're not going to skip that.
Oh, and it can be tough when you've got little kids.
Yeah.
I definitely did struggle with that. And we ended up getting we have an old school Stairmaster. I could do that when the kids were napping. I had a jogger that I would take the kids out and go walking or running with the kids with me.
Yes, so creative.
And then occasionally I would get a babysitter if my husband was working and I couldn't, and I needed to get my exercise in to make sure that I make that a priority, or to go to yoga, or just do other elements of self-care.
Yes. I love that. I mean, I have a rowing machine, but I just got it from my neighbor that was trying to get rid of it. So that was pretty cool.
That's amazing. Yeah, we got our Stairmaster at a second-hand sporting goods store. There's a lot of that out there.
Yes.
So a lot of people have sporting goods that they're not using and are selling it, giving it away. And that's a great way to get a piece of equipment that you can then use, and it doesn't matter what the weather's like.
Yes, and I try to remind myself, even just 10-15 minutes is better than nothing.
I mean, 5 minutes is better than nothing. Just the consistency is really important. And especially if you're just starting out with a habit and you're like, oh my gosh, I'm really out of shape, I can't do this. Start off with something that is really manageable. I mean, it can be less than 5 minutes, just something every day is really, really a great idea. And then you can build on that.
Yes, I love that. And again, not everybody has access to even like a neighbor, like I was saying, that has giving away stuff. So like resistance bands, lightweight.
Absolutely. Resistance bands are great.
Yes, I love that. Yeah. And they're cheap and you can take them traveling.
Right.
Do it anytime. I mentioned that before. I love resistance bands.
Yes.
And then how can we prioritize self-care even in small ways? So we kind of talked about that a little bit, but it's hard with everybody's busy lives and managing families and work and everything. Like, what is the best way, would you say?
I think, trying to tune into yourself and know what brings you peace and joy, and it can be something really small, as you said. It may be that you are surrounded by chaos with kids screaming and someone's delivering something and the phone's ringing. Just being aware, okay, I'm stressed out. So naming that feeling and then being able to just find those moments. What's going to help me calm down? Maybe it is really good music. I have some great mixes for depending on my mood. So music can be helpful. Connecting with your breath. So it can be just taking 4 slow, deep breaths. It can be making yourself a cup of tea or getting a glass of water. It can be getting outside, even if it's not for a walk, just getting outside and connecting with nature. If you can get in a walk, that's wonderful too. That's for me like a really great way to kind of just, if I'm amped up and I've gotten through something that was tough, or I'm about to have to tackle a hard project, sometimes just taking that minute, 5 minutes, 10 minutes to go for a short walk is really a good reset. So I think just again, knowing what's going to help you feel calmer and then finding opportunities to incorporate that into a day. Also, try not to overschedule yourself if you can. I definitely have struggled with that in the past, but my sister, who I adore, who's very wise, said, say no to say yes. And I love that. I keep that in mind quite often, because if you have somebody, ask you to do something and you say yes all the time, that means you're actually saying no to the other things that you could be doing. So I like to remember that.
That is a great tip and reminder. Hard to do. But, I feel like once you kind of get a hang of it, it gets easier to say no. No, just knowing that this is a priority. I will tell my patients, use your MS as an excuse. It is a perfectly acceptable excuse to just say no to that evening event you don't want to go to, or that, whatever it is. The middle of the day luncheon that is just too much to kind of throw your schedule off track, or that birthday party for your friend's kid or whatever. And you're just like, I can't handle it. It's going to be so much chaos. Use MS as an excuse. That's okay. I love that. And it's true, right? It probably is related to our fatigue and just not doing too much, But that's great. I love that. And especially what you said of going for a walk is super important and essential and fairly easy to do, but it doesn't even have to be a walk. Just stepping outside, stepping away from whatever for a minute, listening to music, or I like just listening to the kids playing outside or the birds chirping or whatever's going on around you. Just kind of take a second and do that.
Exactly.
That's perfect. And then what would you say would be just one takeaway point that you like to stress the most out of everything we talked about, or even something that we didn't talk about?
I'm going to need to pause and think about that for a minute.
Sure. Okay. And then last thing I want to talk about is what would be one takeaway point or something just you want to stress the most before we end?
Sure. MS is a really tough diagnosis. It is really a life-changing experience to be told that you have a debilitating brain disease that's not going to go away. There's no cure. Fortunately, we do have some good treatments out there, but it's not not everybody responds to those treatments, and there's still a lot of uncertainty surrounding them. So it's tough, but it doesn't have to be your defining aspect of your life. It's not who you are. And so I think it also can be an opportunity to be healthier than ever if you take it as a chance to like re-examine your life and think about what are some areas where you like to make a change, and really tackle those. And I've seen incredible results in some of my patients who have made those steps to make important changes to their diet, to their activity, to just prioritizing their health overall, to managing their stress. So for me, and also MS was really a launch pad to do more, to really find those things that are meaningful to me. And I've ended up having all kinds of opportunities, like writing this book, Up the Down Escalator. That was an amazing experience that really was there because I had MS. And my work now with people with MS, it's like a net positive that I have MS at my job because I can connect better with my patients. So there have been some ways that I've discovered that MS can be, it's taught me a lot of lessons, and it's even brought me connections and opportunities I wouldn't have had otherwise. So find those silver linings, right? That's I think the bottom line.
I love everything you just said because it's 100% true. Is we can easily fall into like that victim mentality, and not to say like again, we all have our bad days and it's rough, and others have it way worse. So I get that, but there's a quote. I haven't done a quote in a while. I always do a quote, but there's one that says, not every day is good, but there's good in every day.
I like that.
So kind of like what you're talking about is, like there's so many cons with MS and so many things that are negative, but there are also a lot of positive things, and maybe you can help get reconnected with just having support, and kind of just really doing things that, again, out of your comfort zone is like a hard time asking for help. Maybe this will help open that up for you, and you'd be surprised basically on what comes up, and like you said, opportunities and like connection with people. Met, like with you, like being here with you, I would have never thought that I'd be in your house when I went to that book signing. I would have never thought 2 years later I'd be talking to you for So I love that you said that, and that's perfect ending to this. And so I just wanted to say too, again, I thank you and appreciate you so much. You have been just a wealth of information, and not just that, you're a huge inspiration also. So I do have to mention that Miss Lisa just completed last weekend an MS 150 bike ride. So it was, correct me if I'm wrong, over 160-mile ride from Austin to College Station. Bike ride, okay, not anything else, a bike ride over 2 days. And it was, you raised funds for research and whatnot also?
Right, so it's a fundraiser for the National MS Society, and we raise awareness and funds to help with MS research, as well as a lot of great programs run by the National MS Society for people living with MS.
I love that. It's amazing. And that's not the first time you've done that. And you have other many accomplishments, like I said, to go from there.
Thank you.
But, again, like I know we've talked about, like, again, I did an episode before with like my rock climbing episode of just not putting limits on yourself. And I understand, these are kind of extreme cases of what we're talking about. But like, again, don't just don't think that just 5 minutes of walking or moving is not going to be helpful, because it really is. It doesn't have to be anything that you think is impossible or out of reach per se. But just really taking baby steps into improving our health and just doing a little bit more every day. And and real quick too, I want to mention your website is www.lisadoggett.com, right?
Right. Yeah, Lisa Doggett, says LISADOGGETT. Yes. So, and my newsletter that you mentioned is a lot of fun. I send out health tips, usually every month or two. It's not very often. I won't clog your email. I don't share it with anybody. I don't advertise. And there's a link on my website for a newsletter where you can sign up for it.
Perfect. I love that too, because I do love that it's not all the time and you're not getting bombarded with.
I try to keep it short and not make it too overwhelming.
And then it's always perfect because it's got a lot of info on it when I do read it. So
thanks.
And I was just going to say, if anybody has any questions or comments, please post it to my TraXel.com forum. And let's continue to keep each other healthy and happy and support each other in any way we can. Have a great day.
Bye. Thank you.